Welcome. In this medical VR experience, you will learn how to perform a laparoscopic inguinal hernia repair operation. The patient is placed under general anesthesia, with use of breathing tube. Notice that the hernia appears as a swelling in the groin area. Let us begin the operation. Pick the scalpel up to make a keyhole incision into the abdomen at the incision marker. Put the scalpel back in the tray. Pick the 10 mm trocar up to insert it through the keyhole just below the navel. Connect the carbon dioxide tube to the trocar valve inlet. Open the valve and notice the abdomen inflating. Click on the inner trocar hub to slide it out. Pick the inner trocar and place it on the surgical instrument table. Pick the laparoscope cam, then insert it through the trocar cannula and observe the monitor display. Pick the scalpel up again to make the second keyhole incision into the abdomen at the incision marker. Put the scalpel back on the tray. Pick the 5 mm trocar and insert it through the keyhole. Click on the inner trocar hub to slide it out. Pick the inner trocar up and place it on the surgical instrument table. Now you can aim the laparoscope cam to locate the hernia. Pick the blunt grasper up, then insert it through the 5 mm trocar cannula. Use the blunt grasper to start separating attachments from the hernia sac and pull it out of the inguinal canal. Click on the laparoscope to slide it out. Pick the laparoscope and place it on the table. Pick the rolled mesh and place it on the second blunt grasper. Pick the blunt grasper and insert it through the 10 mm trocar cannula. Once the rolled mesh is inserted into the abdomen, click on the blunt grasper to slide it out. Pick the blunt grasper and place it on the instrument table. Pick the laparoscope again, then insert it through the trocar cannula. Adjust the cam to the hernia location and notice the mesh in the abdomen space. With the blunt grasper, try to unfold the mesh and fix it to cover the hernia hole. Click on the blunt grasper to slide it out. Pick the blunt grasper and place it into the instrument table. Pick the fixation device, then insert it through the 5 mm trocar cannula. Use the fixation device to fix the mesh to the fascia with tacks. Click on the fixation device to slide it out. Pick the fixation device and place it into the instrument table. Click on the laparoscope again to slide it out. Pick the laparoscope and place it on the table. Disconnect the carbon dioxide tube and wait to make sure the abdomen deflates. Click on the 10 mm trocar to slide it out. Pick the 10 mm trocar and place it on the instruments table. Click on the 5 mm trocar to slide it out. Pick the 5 mm trocar up and place it on the instruments table. Now the incisions will be closed with sutures followed by a skin closure tape.